Hola, Bel, ¿ya andas por aquí? Ya te vi. Está apagado tu micro. Está apagado el micrófono, creo. No te escuchas. Igual cámbiale la configuración ahí en el micrófono al dispositivo, porque luego agarra por default el de la compu.
Hola, hola, hola.
Hola, sí, ya se escucha.
Ya. Ah, no, pues era un cable.
Ah,
Muy
pequeño
bien.
detalle, cosas que
Sí.
suceden, por eso nos conectamos poquito antes ¿cómo se llama? Para hacer esas pruebas. ¿Cómo estás, Abel?
Muy bien, muy bien. ¿Tú cómo estás?
Bien, bien. A ver, no sé si quieras probar que puedas compartir tu pantalla, tu presentación.
A ver. eh, Déjalo hago grandote. Ah, ok.
Sí, se ve bien. Creo que le cambié un poquito los colores, pero se ve bien.
Sí, ¿verdad? Le cambié un
Sí,
poquito los colores. Ok.
perfecto. Pues más o menos, no sé si Carla ya te explicó la dinámica que se ha estado siguiendo en los pasados. Primeramente que nada, yo pues, les explico la dinámica a los chicos, les digo cómo se llama, que pues la presentación va a ser en inglés, esta va a ser la última de los 7 webinars que se presentaron. Eh, que bueno, que la finalidad de los webinars es aprender, pero también pues que practiquemos el inglés. Entonces, pues toda la comunicación va a ser en este idioma, desde yo la presentación, las instrucciones, los chicos pues han estado haciendo las preguntas también en inglés. Más o menos está previsto que la presentación dure unos 30 minutos o un poquito más y después dejar tiempo para preguntas. Los chicos sí se han animado a hacer varias preguntas, ya sea que las hagan como de manera oral o por medio del chat. Yo las voy a moderar. Pero al principio yo les doy así como una breve introducción, te presento a ti, presento el webinar, les doy instrucciones sobre el registro, la asistencia y demás, y ya te doy la voz a ti, y pues yo ya nada más estoy al pendiente de cómo se llama, de quién entra, sale, admitirlos, y hasta el final, pues ya cómo se llama, yo voy leyéndote las preguntas que estén en el chat o dándole la voz a quien lo solicite, ¿sale?
Muy bien. ¿Me puedo echar algún chascarrillo?
Claro.
Así ya si se ríen, pues sí saben inglés.
Ajá.
Y si no, o no le entendieron, o mi inglés está muy malo.
Ah, no, pero de todas maneras ni prenden las cámaras, entonces no los vamos a ver riéndose mucho, pero esperemos alguna reacción, porque eso de estarle hablando a la sesión espiritista, ¿verdad? En estas clases en línea, está terrible. Pero bueno, pues tú me dirás, a ver, ya todo listo, preparado.
Sí, ya estoy listo.
Muy bien, entonces voy a admitir a los que ya están en la sala de espera. Ahorita hay 49, pero se van sumando a lo largo. ¿Invitaste a tus alumnos, a los de anatomía? ¿Sí?
Sí, los de anatomía les dije.
Ah, muy bien. Entonces déjame ya admitirlos, pongámonos en switch inglés y a darle, ¿sale?
Muy bien.
Cualquier cosa, aquí voy a estar al pendiente, yo voy a apagar mi cámara y voy a silenciar el micrófono, pero de todas maneras yo aquí ando, ¿sale?
Ok.
Muy bien. Hi, everybody. We are waiting for some participants to connect, and we will begin in a few minutes. It's my audio okay? Can you hear me, everybody?
Yes,
Yes.
we can. Great.
Okay. I think that there are no more participants in the waiting room. So welcome everybody. My name is Dr. Miriam Mendez. I'm the chief of the Department of Biomedical Science. Welcome to this last webinar of the 7 webinars that we have organized by the Division of Health Science of the University Center of Tonalá. As you remember, these were a series of 7 webinars, all in English. And as you know, the purpose of these webinars is not only that you learn a different theme and different subjects, so also to practice your English. So all the communication that we have had in these webinars is in this language, in English. So you are welcome to ask your questions to our professor today in this language. Also at the final of the presentation, also in the chat, you can write it and I can read it at the end of the presentation, or you can also raise your hand or open your microphone and ask directly your question to Dr. Abel. So welcome everybody. Before we begin in this presentation, I would like you to remember that the assistance to 4 of the 7 webinars is BQ owner of a certification of assistance. So don't forget to register your assistance. In a few minutes, I will put the link to the Google Forms to register your assistance. Remember that this form will be open only 15 minutes, so don't forget to register, and your certification of assistance, if you are registered to 4 of the 7 webinars, will be sent to your email in January, in the middle of January. So if you have any doubt of the certification, please write to the Division of Health Science, okay? So we are ready to begin. It's a pleasure for me to introduce you Dr. Abel Alejandro Goitia-Berni. He is physician of formation and he is professor of the Department of Biomedical Science. He is professor of the Asignature of Anatomy and Embryology in Medicine and Gerontology, sorry. And the subject of the webinar of today is sutures. So welcome, Dr. Abel, and if you are ready, you can share your screen and begin with this interesting subject.
Hello, everybody. I'm very pleased to be here with you. I see some familiar faces. So I'm going to share my screen now. All right. And I may apologize in advance because you might be fooled by my blue eyes, but I'm not, in fact, an English native speaker. So if I mess up, don't be too hard on me. Okay. So I know that many of you are first year medical students and you are eager to practice. So I came up with this idea so you could learn the basics of sutures and the principles, and you may practice at home. Let's see. Well, about closing wounds. In the United States and I dare to say in the world, most traumatic wounds are closed by suturing. In addition to the instruments used for debridement, a needle holder and suture scissors are required for suturing. So this is the famous needle holder. It has different pieces. You see, these are called the jaws because they mimic a mouth. And it also has kind of little teeth, which are called jaw inserts. And this part of the scissors are called the joints. And it has two shanks and rings for your fingers. You can close and lock uh, the the needle holder uh, by pressing against the ratchets. You see, you might hear a click. So that is your needle holder. And you you will need some scissors, suture scissors. And mine are quite regular. You see, they are usually long, so they don't need a lot of blades to. The blades don't need to be very long to cut through the sutures. And you should know that the size of the needle holder should match the size of the needle selected for suturing. That is, the needle holder should be large enough to hold the needle securely as it is passed to tissue, yet not so large so the needle is crushed or bent by the instrument. Instruments used to debride a grossly contaminated wound should be discarded and placed by fresh instruments for the closure. You see, uh, if your needle holder is quite big, let me see my camera. Okay, maybe you can notice if the needle holder is too big, you could bend the needle. It should be curved, and this needle is almost flat. So let me get it closer to the screen. You see, my needle holder is not too big, yet if you employ an improper technique, you can crush it. It should mimic a circle, not to be, it shouldn't be flat, okay? So the needle should be big enough for the needle holder. Mhm. Okay. Notice how it is how you should hold the needle holder. That is practical. It's not always required that you keep your fingers inside the rings. You can have you should be able to have a free motion of your wrist. You see, and when you grab the needle should be, remember, never grab the needle with your fingers. Always try to grab the needle in the in the third in the outer you can divide your needle in 3 pieces, and you should hold it between the first and the second third. You see? Okay. All right. Um, for most wounds that require closure of more than one layer of tissue, the clinician must choose sutures from 2 general categories: an absorbable suture for deeper subcutaneous layer and a non-absorbable suture for surface or percutaneous closure. So you may remember that there are several different layers of tissue in, okay, I'm not too good with the camera, but hopefully, is it too bright? I guess so. Okay, maybe that's better. You see?
Yes, we see.
There are uh, several layers of tissue. So you may choose a different suture for each layer. You should uh, you should close each layer with the same layer. I mean, if it is muscle, it should be closed with muscle, and skin should be closed with skin. Fascia should be closed with fascia. You get me? I suppose you do. Okay. So uh, these are the different characteristics of suture materials. Um, let me see my camera. Okay. Uh, these are the characteristics of different suture materials, because you might get lost if you see how many different materials there are. But each material has unique characteristics. Uh, Grossly, they are divided between absorbable and non-absorbable. Absorbable materials should be used for deeper tissue layers, and non-absorbable should be used for the surface layers. So, non-absorbable and absorbable sutures, you could set a threshold in the two categories, depending if it takes more than 60 days to be absorbed, to be degraded by the body. If it takes longer, then it is coded as non-absorbable. And so you see, any absorbable suture should be absorbed within 60 days from the body. Now, okay, surgical gut. It doesn't have a very good knot security. The knot security is poor. The tensile strength, however, is fair. It's not the best, but it's fair. But it has the greatest tissue reactivity. So it is something we should avoid. Uh, you see, it takes very few time to be absorbed. the the integrity of the suture lasts from 5 to 7 days, and it has the handling is poor. It doesn't require a lot of ability to be tied. Uh, Chromit catwood, it has a fair knot security, a fair tensile strength, but it causes also the greatest tissue reactivity, so that it's not very good for your body. And it takes 10 to 14 days to be absorbed. Again, the ability to tie it, it's poor. Coated Vicryl. Now we're talking about better knot security. the knot security is good, and the tensile strength is good. The tissue reactivity is minimal, and the integrity of the suture, it lasts longer, up to 1 month. And it has the best handling, so that is very good. Dexon, it has the best knot security, and the tensile strength is good. The tissue reactivity is minimal, but it also takes about 30 days to be absorbed. And it also has the best dyeability. You see, PDS and Maxon, they both have a fair knot security. The tensile strength is the best, but you see, this is a great characteristic, that the tissue reactivity, it's the least tissue reactivity material. So that's very good for the wounds. It takes up to 40 days to 60 days to be absorbed, up to 2 months, and the handling is good. So non-absorbable materials should be used, for example, in skin. Ethylone has a good knot security. The tensile strength is good, and it causes minimal tissue reactivity. The handling is good. Prolen, it has the least knot security, so you may have to do a lot of knots to keep it secure. The tensile strength is the best, and the tissue reactivity is the least. So you see the pros and cons for each suture material. Silk has the best knot security, but the tensile strength is not so good. It's the least good tensile strength, and the tissue reactivity is the greatest. Also, it has the best handling. Okay, so you know a little bit about the properties of the different materials. Now, how about the size and the strength? The size of the suture material, the thread diameter, I mean, how uh, how wide the diameter is related to the tensile strength of the suture. It means the greater the diameter, the stronger the suture is. Uh, the strength of the suture is proportional to the square of the diameter of the thread. Therefore, a 4-0 suture of any type is larger and stronger than a 6-0 suture. So you might be confused, but this might clear your mind. You see, if you have a 11-0, it means it is very thin thread. You might compare a 6-0 to a human hair. So below 6-0, it should be wider than a human hair. And above 6-0, it's thinner. Now, the correct suture size for approximation of a layer of tissue depends on the tensile strength of that tissue. The tensile strength of the suture material should be only slightly greater than that of the tissue, because the magnitude of the damage to local tissue defenses is proportional to the amount of suture material placed in the wound. So this is a big deal, because we don't want we don't want a lot of reactivity from the wound. So we should place the least material required. So which materials are most useful in emergency settings? Texon encoded Bicryl for subcutaneous layers, and synthetic non-absorbable sutures, for example, nylon or propylene for skin closure. Fascia can be sutured with either absorbable or non-absorbable materials. In most situations, a 3O or a 4O sutures are used in the repair of fascia, and 4O and 5O absorbable sutures in subcutaneous closure. Now, FAR O or 4O non-absorbable sutures in skin closure, lips, eyelids, and the skin layer of facial wounds are repaired with 6O sutures. So nobody wants a big suture in your face, right? And a 3O and 4O sutures are used when the skin edges are subjected to a considerable and dynamic stress. For example, wounds that are overlying joint surfaces or static stress, such as the scalp. No, your scalp needs a stronger suture. Now, the needles can be eyeless, which means you don't see the hole in the needle in which the thread goes inside, or they can be swag. Uh, the needle is used for wound closure needles are used in wound closure in most emergency centers. The selection of the appropriate needle size and the curvature is based on the dimensions of the wound and the characteristics of the tissues to be sutured. In wound repair, needles must penetrate through fibrous tissues. It could be skin, subcutaneous tissue, or and fascia. Yet, uh, they should slide through these tissues with minimal resistance or trauma without bending. You see? So this is a regular needle, and these are the different parts of the needle. This is the thread. We talked extensively about the different threads. There are monofilaments. There are threaded filaments. Uh, for example, this is a swagged eye uh, needle, which means you don't see where the eye is. It is hidden inside the needle. The body of the needle and the point. Now, uh, this is interesting. So there are half circle needles, or there are 2/3 of a circle shaped needles. Now, you see, this is what we talked about, that the needle should be large enough to pass through the tissue, yet it should be they should be able to reach far enough to enable the needle holder to be repositioned at the end, and to grab the needle again. So if the needle is too small, you won't be able to do this. Mm. Always remember, although it might be tempting to use your fingers to grasp the needle tip to pull the needle through the skin, this practice risks a needle stick. Nobody wants to get a needle stick. Not you, not me, anyone. So the clinician should either reposition the needle holder or use forceps to disengage the needle from the laceration. You see, these are half circle needles, 3/8 needles, 3/8 of a circle. Check this out. You should also pay attention to which type of suture you're using. Uh, this image, the B image, uh, it shows you the different types of point in the needles. This image B, it has a reverse cutting edge needle. You see, the outer edge of the needle, it has 3 edges, but the outer edge, it is pointed. So it can cut through this edge, and this other edge. This is very useful for tissues that are really strong. As we said earlier, for fibrous tissues. And these other needles, which have the point, which are pointed inwards, the curvature of the needle, these are not so good for cutting through tough tissues. So the light and the exposure should be optimized, placing the wound at a comfortable height for the clinician at a sitting or standing position at one end of the long axis of the wound. This is very important because you don't want to have your back aching, or you don't want to have to be lacking of strength while you are suturing. You want to have an ergonomic position, and you also want to be able to see what is going on with the suture and the wound. So remember, it is very important to place a proper field, and before you start digging, before you start cutting or even suturing, you should clean everything up. You should be very thorough with the cleaning, and also placing anesthesia. The skin surrounding is prepared. The skin surrounding the wound is prepared with povidone or iodine solution. I have some here. Okay. Uh, and it should be covered with sterile drapes. Some surgeons do not drape the face, but prefer to leave facial structures and landmarks adjacent to the wound uncovered and within view. This is so they don't lose the sight of the shape of your face, right? And a clear plastic thread can be used to provide a sterile field and a limited view of the area surrounding the wound. If no drapes are used on the face, the skin surrounding the wound should be widely cleansed and prepared. You should also know that face wounds should be sutured by plastic surgeons. So you see, the this wound is being prepared, is being cleaned thoroughly. Irrigation sometimes is in order, so so you see there are no foreign objects inside the wound, and also to see which anatomical structures are can be seen, if there is any damage, and how far the damage goes. Now it is placing anesthesia in the skin. Remember, we are human, we feel pain, so we want to minimize that experience. And at the end, I have some advices for how to calculate the anesthesia that can be given. It is better if someone is helping you, if you are actually suturing a human being. You see, everything is sterile in this area. Nothing is being touched directly without a proper clothing. Handle with care. Skin and subcutaneous tissue that has been stretched, twisted, or crushed by an instrument or strangled by a suture that is tied too tightly may undergo necrosis. We don't want that. An increased scarring and infection may result. When the edges of a wound must be manipulated, the subcutaneous tissues should be lifted gently with a toothed forceps or a skin hood, avoiding the skin surface. So do not press too hard on the edges. You don't want to cause any necrosis. When choosing the suture sizes, the clinician should select the smallest size that will hold the tissues in places. Skin stitches should incorporate no more tissue than is needed to coap the wound edges with little or no tension. Knots should be tied securely enough to approximate the wound edges, but without blanking or indenting the skin surface. So I made some previous sutures with my pig's hand, so you can see this. Okay, let's see. For example, this suture is just too loose. I don't know if you notice, it doesn't coap the edges very good. But this one, in the other hand, it coaps the edges pretty well. Did you see? I hope you do. Okay. Okay. Maybe. Okay. So is it how is it done? The actual suturing. I don't know if many of you have already brought your pig's hand and are prepared to do the suturing. Maybe I should start with the scalpel. Okay. You see the scalpel? It has some. It has a shape. It shines a lot. Okay. It has a groove here. Let me take the group matches the blade. The blade, this hole of the blade. It should be slide into the blade. You see, it has some ridges. You should push. Then you make here a click. So, oh, I placed it the wrong way. I wasn't. Okay. So here we go again. You see, it should match. And then you push until it is mounted. Okay. Now, let me grab the needle. You see, I'm using my forceps. Look how I use the forceps. You don't want to use it like this. No, no. This is how you hold it. You see, like if it were chopsticks. So you may want to enter. Let's see. You want to have a 90-degree angle. I don't know if you can see. 90-degree angle. And you use the forceps to hold the skin, and then you push. You see? And then you can see the end of the needle. Again, you must use the forceps, the needle holder. I don't know if you guys can see this. You pass it through the skin, and then you go again. You reposition the needle on the needle holder, and then you select where you want to push through. You push through, and again, you have to leave some thread so you can make your knot. Now, about making the knot. You see my needle holder? You are gonna make 2 loops above. I don't know if you can see this. This is 1 loop, the second loop, and then you take the end of your thread and you slice the knot. You see how it is closing? Now you approximate the edges. There is some tension in the wound. Now I went above the first times. Now I will go under. You see, 1 loop, and I take the end again. Well, I said I take. Okay. There you go. You make another one. Okay. I guess the other one didn't pass through. Okay. The last one. But now you go above. So remember, twice above, 1 under, and another 1 above. Now I place the knot right alongside the wound edge. I didn't put it above the edge, so it wouldn't take extra stress. You see? And now I will cut. You got it? Are you trying this at home?
Yes, teacher.
Awesome. How did you do? Can you show me?
I didn't understand well.
Oh, that's too bad. Remember, 90 degrees angle to go inside the wound. You can put the needle through the open wound. Then you reposition it. You again, let's see. You enter, you take it again, then you enter again, and you pass through the whole tissue. You make the knot, and then you cut the suture. Remember, you may try to use just enough stitches to keep the edges closer together. You may not see you shouldn't see the wound opening. That is bad. Look, this is a lot of stitches for the wound. Too much. These are too few stitches for the wound. This is perfect. You see? Maybe I can show you mine. I don't know. It just shines a lot. Okay, that's better. You see mine?
Yes.
This is way better. I guess I needed a cameraman. Look at this. This is how you calculate how many anesthetic you should use for the wounds. 4.5 milligrams per kilogram of lidocaine, and it should last for 1 to up to 2 hours. Obviously, you don't want to go above 300 milligrams. Now, these are different suggested thread diameters for each part of the body. The scalp should be 3 or 4.0, and you should get rid of the not absorbable sutures within 5 to 10 days. I'll give you this presentation so you can take a better look for each part of the body and the suggested thread diameter. This is very important. Take a look at the tension lines of the body. So if you make an incision, you should make it in the way that it doesn't have a lot of tension in it. So if I slice in this direction, then the wound will not have a lot of tension. But if I slice in this direction, if I slice perpendicular to the tension, then the wound will be far more difficult to be repaired. Okay. I'm gonna show you with some images because I guess it will be easier for you. Wait a little. I have some images that might be helpful. Miriam, could you see the way I was making the suture? Because I don't know if my camera was good enough.
Yes, it seems really good.
Okay, I have some photographs that might be helpful. Okay. Where's the photos? Here. Okay. This is just what I did. Let me show you. Here are some photographs. Okay. Now, you see how it enters at about an 90-degree angle? You are watching this, right?
Yes, the photograph seems good.
Okay. And now it goes all the way until you see the point of the needle. And then you start going inside the other edge of the wound. And then you can see the needle again. You notice how he never touches the needle with his hands. He always uses the needle forceps, the needle holder and the forceps. You see? It goes through and he has to leave some thread that he can hold later. He made 2 loops around the needle holder going from above, and then he took the end of the suture, and it is going to pass through those 2 loops. You see, it already passed from the 2 loops. Again, he performs now another loop, all this while maintaining the tension. But the new loop he's doing, it starts from below. There goes the loop. So it should be 2 loops from above, 1 from under, and then 2 loops from above again. And then you just cut the thread. That is a simple knot. There are different types of knots, but I guess you can begin by experimenting with the simple knot. It is also called the square knot. Okay. So far, any questions?
I have a question, doctor.
All right.
What is tissue activity on the thread material on the table?
Well, it means you may have greater inflammation in that place. You see, our immune system can detect if there is a foreign object inside of bodies, and it will create a reaction which starts by causing edema, and it might cause even a fever. Yeah, that is inflammation basically. All right. Any more questions?
I think that there was a question in the chat of Salvador Mercado. I don't know if Salvador wants to make it or he wants that I make it to you.
Okay. Salvador, want to make your questions?
I can read it.
All right.
The question of Salvador was, Doctor, in what kind of situations should we use the surgical gut?
Sorry, I didn't get you.
Sorry, I can repeat it. Dice that in what kind of situations you should use the surgical gut.
Well, it is more of uh, more of what in your institutions they use. Did I turn on my video? Yeah. Okay. I'm sorry. Yeah. I was telling you, you should use it for deep, 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 deep layers of tissue. But you see, not every institution has all type of sutures. So you may use it if it is available to you and there is no other better material there.
Okay. I don't know if you have another question to write it in the chat of somebody want to make it directly to Dr. Abel.
Yes, I have a question.
Yes, Eduardo, go
Okay.
on.
For example, I want to know that what is the correct space between each shooter?
Yeah. It should be about 5 millimeters. 5 millimeters to 8 millimeters. As long as the edges are together, are close enough, and you don't see any tissue below, as the picture I showed you. So there should you shouldn't be able to see any gaps between the edges of the wound, but it shouldn't be too tight because it could have more reactivity, and it could have necrosis if it is too tight.
Okay, thank you, teacher.
You're welcome.
Hi, I have a question.
Go on, Viridiana.
How do you know that you did the suture right? Not so tight.
Yeah, you can grab it with your forceps. Let me show you again, because I made one too loose just to show you how loose it was. Okay, yeah, that's better. You see, this one is too loose. You see how I can move it?
Yes.
It is way too loose. These ones are perfect. You see?
Okay.
You can see below. You can see the edges. You can see the tissue that is under. Okay. Yeah, this is better. I need a macro lens. Okay.
Okay, thank you.
I do have another question.
Go on, David.
Okay, thank you. First of all, I want to say congratulations. It was a very good chat. And my question is, I want to hear your opinion about this. If we get to have a patient that comes up with us that was bitten by a dog or by any other type of animal, will you recommend to close it with this type of procedures, or what do you think should be the best decision on this? Because I see a lot of opinions around this type of procedure, and I don't know.
If the where was the patient where was the wound made, or what was the
Yeah,
conditions of
like
the wound?
if a patient gets bitten or gets a
Okay.
bite or something like that.
You mean like with the fist?
Yeah, exactly.
Okay. it should be hard if for a fish to break the skin. Remember that the skin is usually elastic. It has elastic fibers inside. But anyway, you could use the suture. You could use the threads. You could use this technique to suture someone that has a laceration of the skin, as long as you can follow an edge to 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 recover the original form. If it is too messed up, you may have to use another technique such as skin grafts.
Okay, thank you.
You're welcome.
There are another question. Yes, Michelle, I think that you raised your hand. Michelle Gallegos.
Yeah, doctor, what kind of material do you recommend us to practice like these sutures? More like the arm skin or the hardness of the scalp?
Yeah, I should. I could use. I recommend you to use nylon. Nylon, it's very good. I really like nylon for all the skin.
And for what practice? Oh, sorry.
No, you may go.
And for to practice, like the hardness of the skin, I mean, like maybe an orange or muscles. I mean, meats, maybe. What kind of meat?
Oh yeah. Well, I'm using pig legs because I I don't know, it is kind of easy to get, and it is pretty similar to our skin. Yeah, it's not a joke, but as it sounds like a joke, but yeah, you can even use grapes. I mean, I have heard of people using grapes for suturing, for practicing their skills. But if you use grapes, you should use a very thin suture material. I don't know, like 7/0 or 6/0 sutures.
Okay, thank you.
You're welcome.
I also have a question.
All right.
In the case of a wound made by a bite, as my companion said, we should suture even if the borders are aligned.
You should clean very thoroughly, and you can use simple stitches to suture that kind of wound. You see, if a lot of wounds won't close if you don't suture them, but you should avoid to use any continuous suturing. If there are separate stitches, it is okay. And depending on the bite, you should add some antibiotics. I mean, if it is, I don't know, from dog's bite, you may have an infection caused by Pastorella multocida. That is a common bacteria from dogs. But you may add amoxicillin, and that will be okay for that wound. Just
All right,
make
thank
simple
you.
stitches. You're welcome.
Okay, another question. Yes, Salvador Mercado.
Hi, doctor. Just one question. You mentioned at the beginning of your talk, the surgical gut, that it was absorbed like really quickly, like 5 to 7 days. So what kind of tissues should we use that, since it's absorbed pretty quickly?
Yeah, it is to be used on deep tissues. For example, I don't know if you are suturing viscera, you could use the surgical gut.
Thanks, doctor.
You're welcome.
Okay. I think that there are no more raised hands or questions in the chat. Nope. Everybody?
I want to make just one last question.
Yes, go on.
Okay, and what if we had a patient with a necrotic finger? For example, if he has a cut on it.
If it is necrotic, you should remove every necrotic tissue. That is almost written in law, because if there is no viable tissue, it could become food for bacteria. So every non-viable tissue should be removed.
Okay, thanks.
You're welcome.
Okay. There is a question in the chat from Joe Ceja. He says, what is your opinion about the alternatives methods of suture like skin adhesive?
Mm-hmm. Well, personally, I haven't used them, but I mean they have their usefulness in different kind of settings. For example, in war settings, there are some uses. So if I mean if that is a really an emergency in which you don't have the means to take the time to see the wound and properly make the stitches and all, you can use any other methods. There are even I don't know, so some of them are have been designed to save time, and some of them also have other advantages, and some are good. I mean, there are a lot of different methods, but if you are going to practice here in Mexico, in thinking about an emergency setting medicine, there you won't need any other methods. So they are good, but they are mainly used for to save time. You can use staples. There are special staples, but actually there are some devices which are designed to be used even in certain surgical procedures. For example, there are staples which are special for gut. And I don't know, if you are going to perform a colectomy, if you are going to take out a tumor from the colon, you will need a special staple, because that surgery might take up to 12 hours without that staple. But if you use that special staple, you will take 6 hours. So there are some settings in which these other methods are more useful. Did I answer your question?
Yes, he say that. Yes, thanks. Okay, if there are no more questions, I want to thank Dr. Abel Alejandro Goiti in name of the Division of Health Science of the University Center of Tonalá, and also thank you all your interest and your questions for this important subject about medicine. It is very important, as doctors say, you to know the correct technique to avoid some accidents when you are suturing. So this subject I think is very important for you. And I want to remember that the students that, or the professors that assist to 4 of the 7 webinars will receive their certification of assistance in the middle of January. So take advice of your email for the reception of your certificate. And thank you for your assistance. Be advised to assist to the webinars that will be organized for the 2021. So thank you everybody, and take care. We are in touch for future webinars. Thank you, Dr. Abel, for your excellent.
You're welcome. I'm very glad to see so many familiar faces. Hope to see you sometime soon in person, right after everything of the pandemic has passed away. So
we hope that soon we can see all our faces in the CUT that miss you a lot.
Merry Christmas.
Thank you, everybody. Have a good night and take care.